The first cries of a baby are music to the new parents' ears, and in their early days, crying will be your baby's way of telling you what they need. It will take a little while for you to get used to your baby's cries, but soon you'll learn how to understand them so you can provide comfort.
It's perfectly normal for the newborn baby to cry. From when the baby is born initially, the baby takes that one life-starting breath, that lovely luscious cry comes out when the baby exhales. And babies cry for any number of reasons. Initially, it's not because there's anything wrong, it's just how a baby communicates. The reason why your baby can cry is if the baby is hungry, although generally that's a late feeding cue. If your baby has a soiled nappy, if your baby is windy. If your baby gets upwind, they'll probably be hungry again because the wind has taken up the space of food. Once they've burped, they might want more food. If your baby is being overhandled, which is very common in the first couple of days with all relations visiting and handling the baby, your baby can be very, very unsettled and crying a lot, especially at night. Ways to comfort the baby then: pick the baby up. Can't really spoil a newborn baby. You could check their nappy first of all and make sure they're dry, they're not dirty, the nappy's not too tight, clothes are not restricting. Pot the baby onto the chest, making sure the baby's face is free so the baby can breathe. You can rub the back or pat the back to help baby get upwind if wind is the problem. Making sure that the baby's legs are nice and straight, the bottom is to the chest so that the tummy is good and straight there like that. Putting the baby in your arms and gently rocking the baby. Babies can get very, very irritated if you kind of jig them, and never, ever, ever shake a baby because it can have serious consequences. Colic is the uncontrollable crying in a newborn, otherwise healthy, well-fed baby, where the baby cries uncontrollably from 1 to 4 hours. The baby is often crying, their face can be red, they can have like a full-looking tummy, the legs are pulled up to their chest, and they're really, really upset. It is very, very upsetting for parents as well, seeing their baby so distressed.
Although there's no known cure for colic, there are some ways to soothe your baby. Let him suck on your clean finger, rock him gently in your arms, wind him thoroughly during and after feeding, or try bringing him for a drive or a walk. Never, ever shake your baby. This can be very dangerous.
Holding your baby in a position where your baby is sitting on your knee, holding their tummy straight so that the wind can come up, and maybe gently, very slowly in a circular motion to try and get the wind up. And that can be comforting to a baby also. If your baby is very unsettled, holding the baby, looking outwards with your hand on their abdomen, nice and secure there, and it can help them get upwind, and to rock the baby like this, or even when you're walking around to do a stepping motion almost, and that can help a baby get upwind and can be very comforting.
Although all babies cry, there are times when crying may be a sign of illness. If they have other symptoms such as a high temperature, contact your GP. If you're in any way concerned, seek medical advice.
There are a few common indicators if your baby is unwell. Obviously, if your baby had a high temperature or fever, or if your baby is off form, fussy, and is not behaving normally. Another key thing when young infants is that if their feeding goes off and they're not feeding well or they're vomiting. But there are some other things to look out for. If your baby had a suspicious rash, or if baby appears excessively irritable, is difficult to settle, is crying a lot, or if baby is very lethargic or difficult to wake from feeds. There are some other things you could look for, like if baby is having excessive bowel motions or diarrhea, or if the bowel motions smell particularly offensive. Don't be afraid that any question you ask will appear silly or foolish. It is very important, if you're worried about your baby, to look for appropriate advice. Vaccination is very important to protect your young baby. There are a range of vaccinations which are provided by your general practitioner. They are free, and the general practitioner or the practice nurse at your local GP practice will give the vaccination. These vaccinations protect against a range of very serious illnesses. In the case of premature babies, they also receive their vaccinations commencing at 2 months of age, and you would discuss this with your paediatrician. Like all medications, vaccinations may have some side effects like swelling or soreness in the area of the vaccination or a low-grade temperature. Your doctor or nurse will advise you on these potential side effects and what to do.